Good afternoon, everybody. I would be speaking on aesthetics and oculoplasty. Now, why aesthetics and what is the need to introduce aesthetics in oculoplasty? So aesthetics basically means something which is visually pleasant. So basically aesthetic and cosmetic eye procedures are a group of those procedures that improve the appearance of the eye as well as the face. Now, but most of these surgeries are not performed on the eyes, but they are performed on the surrounding tissues rather than on the eyes. So the scope of aesthetics in oculoplasty is basically first in reconstitution of orbital structures, second in correction of eyelid deformities, and third in enhancement of eye appearance. Now, there is huge importance of aesthetics in oculoplasty and otherwise also in our daily lives. The foremost is that it enhances the self-esteem of the patient. It enhances the overall facial aesthetics and definitely enhances and boosts the confidence of the patient in the social settings. Now, to simplify the classification, I have classified the aesthetic procedures into two. First is non-surgical and second is surgical. So to briefly enumerate non-surgical ones, most importantly, which we are doing most commonly is the botulinum toxin injection. Second are the fillers. And third are the rejuvenation procedures. Most of them are done by the derma friends. Surgical procedures I would like to simplify and classify as blepharoplasty, ptosis, and browplasty. Now to talk a little about botulinum, it has come a long way from being used as a war toxin to now used as a therapeutic procedure. Basically, in simple words, it basically inhibits the release of acetylcholine at the muscle, so it causes a muscle paralysis. So acetylcholine is inhibited at neuromuscular junction, which causes the paralysis of the muscle. It's a light chain and heavy chain, so not going into the detail of the molecular structure. Commercially, botulinum is available as a type A or type B. Commercial names are there, and type A is more popular because it's stable, purified, and has a longer duration of action. It has to be reconstituted with sterile, non-preserved one, and it should be definitely stored in refrigerator at 4 degrees Celsius, and after reconstitution, although the label says it has to be used in 24 hours, but we can comfortably use it for 6 weeks. Now for different clinical conditions, as I have listed, the dosage would be different. Now indications would be, most importantly, botulinum is used in facial dystonias, for example, hemifacial spasm, BEB, oculomyokemias. They can be used in senile entropion, tarsorrhaphy, and for cosmetic indications used very widely these days for dynamic facial wrinkles and chemical brow lift. So now this is a patient of abnormal twitching. You can see in this patient, you can see this is a patient of hemifacial spasm, and you can see closely, and here it becomes very difficult of these lives of these people. So here we are marking it, and you can here see that the twitching has gone, and here the patient is fine. This is a patient of benign essential blepharospasm before injection, and so the life of such patients is really difficult. And you can see here, before injection, this is a patient after the Botox injection. So injection of botulinum toxin results in varied degrees of muscle weakness depending upon the concentration and the dose we have used. Effects are basically noticeable within 1 to 2 weeks. They peak at 2 to 3 weeks, and actually they begin to subside at 4 to 6 months after administration. So that is to be told to the patient beforehand. Now these are the patients in which we can use in the facial wrinkles. They are the pictures of crow feet before and after. Here we have glabular furrows before and after picture. This is a picture of wrinkles before and after the use of botulinum, and these are a picture of the forehead lines. So the contraindication will remain motor neuropathic disease, any neuromuscular junction disorder, pregnancies that has to be avoided, any cases of infection, and hypersensitivity, they need to be avoided. Complication can happen if we do not take in regard the dose, and if we go in the wrong planes or we overuse it. It can lead to ptosis, leg of thalmos, entropion, ectopion, epiphora, diplopia, etc. Now coming to dermal fillers, the dermal fillers can again be of reversible, semi-permanent and permanent, and out of those, hyaluronic fillers are more popular because they are more natural occurring, they are biodegradable, dissolvable, reversible, have a good safety profile. They would be indicated in facial lines, post-surgical traumatic scars, dark circles, and most commonly these days in tear trough hollows. And I'll show you the example here. This is a preoperative patient of these tear troughs, as we see as the hollows, and after use of the fillers, the cosmetic appearance has improved a great deal. The contraindication would be if it is positive to skin testing, autoimmune disease, and anaphylaxis, and of course patients of unrealistic expectations have to be excluded. Complications can be allergic or vascular, or it can lead to abscess very rarely. So the pros of fillers are that they are give very instant results, easy technique, simple OPD procedure, but they can be short lasting, costly, and can cause some adverse reactions. Coming to the surgical ones in short, so the most commonly one is blepharoplasty, which would be most commonly indicated in dermatocalcinosis and staphylonephron. Here you can see this is a patient of this blepharocalcinosis, pre-op picture and post-op picture. This is a patient of staphylonephron. You can see this lower fat, which we can see becomes very cosmetic, unpleasant, and you can see the picture has improved a great deal after the blepharoplasty. Upper lip blepharoplasty, in short, I would say we would mark first, we do pinch test here, we remove the skin along with the underlying muscle in one layer, and then we close it with 6-0 silk. Similarly, lower lid blepharoplasty, there can be two approaches, transconjunctival and from skin side, we prefer transconjunctival approach. We apply traction suture, we give incision, expose the fat. In the lower lid, we have to be very careful about the inferior oblique because we have to remove central fat, nasal fat, and lateral fat as well. And then we reposit the conjunctiva, and it looks like this. Now coming to ptosis, as we know, ptosis is basically can be divided into mild, moderate, and severe. So we have to see for the risk of amblyopia, and cosmetic concern is definitely, this is a patient in which we do fastener savate procedure in a mild ptosis, left upper eyelid, pre-op picture and post-op picture. Here we are doing levator resection in 20-year-old boy with moderate ptosis in left eye with good levator function, and post-operatively it looks like this. Similarly, frontalis suspension is done in a patient of severe ptosis with poor levator, and it improves to a great deal. And this is a ptosis repair done for aponeurotic ptosis in a 63-year-old female, bilateral. And so this is it. Thank you so much.
I think it's a, please stay on. Yeah. You have given such a fantastic presentation, and I think we need some comments on that. Sure, because we still have time. Okay. We'll make use of that. As far as this fillers are concerned, what do you think, how practical it is in our scenario, and what is the availability?
So availability is not an issue. Actually, the use is basically for cosmetic purposes. So it depends how much cosmetic aware we are and how much are we working in that part of the socio-economic status of the people. So only people from higher socio-economic status have that much of time and money actually to invest in looking more pleasant as they are. So that way, but I would say the use of botulinum has made a great difference in lives of people, especially these patients of blepharospasms and hemifacial spasms. The life changes actually, although repeated injections, it remains an economic burden to them. So, but I think blepharospasm, they have done a great deal in the lives of the people.
A word about availability.
Availability is not a problem at all, sir. Availability is not a problem.
How long do these fillers last on one shot?
So fillers last for, so cost would be higher for fillers. It would be something around 30,000 to 50,000, and they would last maybe for 1 year to 1.5 fillers. Toxin, botulinum toxin lasts a little shorter period, like 4 to 6 months sometimes, but that's how it is. Until we have some long-lasting treatments, we have to depend on these.
Yeah, thank you.